Rishi and the Celiac Society of India for organizing this very timely and important symposium on gut health and lifestyle disorders. So there has been immense learning. Since the morning we've been hearing about the gut being central to almost all aspects of health. And while we believe that the gut was just about digestion of food, absorption of nutrients, and removal of waste material from the body, we now know that 70% of the body's immune system is found in the gut. It is the largest immune organ. It has its own enteric nervous system, and therefore it is also the second brain of the human body. About 30 neurotransmitters are being made in the gut, and it is linked to the brain through the gut-brain axis. But what allows the gut to function? And we also learned today that we have more microbes than human cells. We are at 10 trillion human cells, and we are 100 trillion microbes. And these microbes, most of which are located in the gut, they basically influence several mechanisms. So they tell you whether they're going to be pro-inflammatory or anti-inflammatory. They decide whether they will ensure a strong intestinal barrier or so-called leaky gut. And they also tell you whether the food that you're eating is going to get converted into a short-chain fatty acid, which is a very important source of energy, or it is going to get converted into poisons and toxins, which can then get entry into the circulatory system through the leaky gut. So while we heard today that a lot of these microbes, majority of them are in the gut, but today we know that almost every part of the human body, including the intrauterine environment, is bathed with microbes. So the amniotic fluid, the placenta, bathed with microbes, and these microbes, they vary in types, numbers, species, in pregnancy, during preterm, in health and disease. And with that, I invite Dr. Neelam Clare. She is going to, so that's why this session on gut health and women. So basically, Dr. Neelam Clare is going to dive deeper into the subject. And we have her. She is the chairperson of neonatology at Sir Lankaram Hospital. And we welcome you, Dr. Clare, for a very interesting presentation on
and lifestyle disorders. Just to set the stage, and since I have 15 minutes, we have something like 26 million women who become pregnant every year. And out of them, 1 million deaths in utero happens. That's what is called as stillbirths or silent deaths, which is death in utero. And 1 million baby born after birth do not survive because of certain problems. They are born preterm, or they have infection, or they have other problems. So we are talking about the gut microbiome of pregnant women, and it not only affects them, but it also affects their offspring. So we are actually talking about 52 million lives, and it is unfortunate. I thought that even in healthy women also, when they become pregnant, their gut microbiome changes. And it is not only the gut microbiome, it is also the vagina, the oral cavity, the skin, and the milk which they produce for their baby. The microbiome or the microbiota changes. As you've been hearing, we have a double jeopardy. We have on one side malnutrition. We have 40% of the women, especially in the rural population, who are malnourished, undernourished and stunted. But at the same time, the incidence of obesity is increasing, and it is to the tune of 12 to 13%, which is pretty high for a developing country like India. When we talk about obesity in pregnancy, it also includes the postpartum obesity, and as you know, the adverse effects of obesity are gestational diabetes mellitus, hypertension during pregnancy, complications during childbirth like a large baby or a giant baby which can have problems at with the birth, and congenital defects. So gestation gut microbiome is a metabolic organ of the human body that its imbalance will not only affect the obesity but also diseases related to the obesity like hypertension and gestational diabetes mellitus. So when we look at the criteria for obesity during pregnancy, we take into account what was the pre-pregnancy weight. So if you are already in the obese range or in the overweight range, then the allowance of the weight is much less as compared to the baby. I think most important thing is to have a vaginal delivery, give skin to skin care, which we call as KMC or kangaroo mother care, and breastfeed the baby. As I already said, that there is a relationship between the unhealthy microbiota and the brain development, and there are experimental animal models where it has been shown that maternal microbiome has a direct effect on the brain development, microglial maturation during the prenatal development. So if it's not only that obesity and metabolic disease predisposition is more common in these babies who are exposed to the maternal gut dysbiosis, but also it affects their brain development. Modulation of the gut microbiome. So gut microbiome modulation is one of the appealing possibility, and pre and pro probiotics have been used, as previously you've been hearing about it. Though the research is still in the nascent stage and we have very limited human data, but there are large Cochrane meta-analyses which have looked at the effect of probiotics on gestational diabetes mellitus during pregnancy, effect on hypertensive disorders in pregnancy, and also on the outcome of cesarean section. But unfortunately, none of these meta-analyses have shown a positive effect. If you look at the differences, no difference has been shown in the neonatal mortality, weight of the baby, or the liptogram of the mother, breastfeeding rates at 6 months, or the quality of life. Any future perspectives which can help. Dietary components are very important, the kind of diet you provide, because it has effect on the pregnant woman, it has effect on the mother's insulin control, on her blood sugar management. Dietary components or a lifestyle management probably would be a very important area where in the future, along with the pre and probiotics, one could work. In the end, I would like to leave a message that pregnancy is a unique event where hormonal, immune and metabolic changes are taking place. Physiological changes and pathological disorders in the pregnancy, name it obesity during the pregnancy, name it diabetes mellitus, name it the gastrointestinal problems the mothers have during pregnancy like hyperemesis gravidorum. The composition and the diversity of the gut microbiome is very important, and imbalance in this gut microbiome is probably related to many of the pregnancy-related complications. So, association of maternal microbiome with fetal inflammation. And we are just trying to understand the microbiome. We are just at the threshold. And maybe the coming decades, we will know more. And maybe by the next conference or by the next decade, we'll be wiser. Thank you so much.
बहुत साल पहले हमारे यहाँ भी माएँ तो अस्पताल में जाके बच्चा नहीं पैदा करती थी, वो घर पे ही डिलीवरी होती थी। कोई घर की बुजुर्ग औरत ही उसे हेल्प करती थी, तो बच्चे तो तब भी पैदा हो जाते थे और बच भी जाते थे, लेकिन उसमें से कुछ मर भी जाते थे। तो आई थिंक जितना इवॉल्व होते गए हम, उतना ही ह्यूमंस का वो कंपेयर टू माइस या कंपेयर टू यूरिन, घोड़ा या गाय बहुत डिफरेंट है। और मतलब जैसे जैसे हमें प्रोटेक्शन मिलती गई, हम ज़्यादा निर्भर हो गए गैजेट्स पे, साइंस पे, तो नेचुरली हमें उस पर डिपेंडेंस हो गई। अब चिड़िया तो किसी अस्पताल में नहीं जाती है, नेचर पे डिपेंड करती है। तो बाज़ दफ़ा मुझे लगता है कि नेचर भी उसे प्रोटेक्ट करती है। इज इंक्रीजिंग। नंबर वन, वी आर डायग्नोसिंग। Before this, like if a child was not speaking for 2 years, we were not worrying. If the child was not getting stimulated by the environment, we were not worrying. But now we are worrying about it. Secondly, autism is more common in premature children. Autism is more common in children who had problems at birth, like asphyxia, where stimulation is not done. More of screen time, where if you see a family, the mother and father, the mother is busy on her phone, and the father is also busy on his phone, and the child is just busy with the TV, watching the cartoons, or he's also busy on a smartphone. So there is lack of stimulation, which happened in West before us. In India, we had more joint families. The grandparents were a great stimulus to the child. They would talk more often. With the nuclear families, that is gone totally. So that is also one factor that we're seeing more of autism, because children are not getting stimulated, the brain is not getting stimulated, so they are having delayed development, they are having problem with the behavior, they are having problem with the learning. So there are multiple reasons.
So ma'am, you are trying to say that the main issue is happening post-birth.
No, that's one of the issues. I wouldn't say that is only. Now we are also saying that change in the gut microbiome is also playing a role in the brain development. Like, those mothers who have dysbiosis, where, if a mother has more of inflammation, she has more vaginosis, that means she has more vaginal inflammation, and the baby is also exposed to the inflammation, the brain development gets a setback. So these babies can have maldevelopment of the brain, they can have problems with their microglial function, so they learning disorders. So that is why there are multiple factors that we see autism more often, and it is going to become a huge health problem, because the schools don't accept those children because they are so slow learners. Parents are also sort of perturbed because the children can't find the right school. So that is going to be a huge problem.
Teacher, I came across this article and I have to sort of tell it to you verbatim what they say, that studies have shown that the gut microbiota of PCOS patients is related to the occurrence and development of insulin resistance, hyperandrogenism, chronic inflammation, and metabolic syndrome. And these can affect the clinical manifestations of PCOS through the short-chain fatty acids, liposaccharides, sex hormones, and brain-gut axis. So what we've been listening to and hearing about the whole day. And in polycystic ovarian disease patients, this is what we see. We see obesity, we see signs of hyperandrogenism like hirsutism and acne, and we have hormonal disbalance like irregular periods and ovulatory cycles. And all this it's a spectrum of disease which we are seeing, and now we find that yes, it is related to the gut microbiome.
It is, yeah.
And yes, girls these days have a more sedentary lifestyle, and the diet is also definitely different. It's different from what I think our mothers and grandmothers used to have. So that plays a major role in it. So I think all these factors together contribute to this epidemic of PCOD which we are seeing these days.
Thank you, Dr.